we'll be tackling a heart-wrenching issue that cuts to the core of our humanity, the dignity of patients in Nigerian healthcare facilities. What do you think about that? Behind every patient is a story of hope, fear, and vulnerability. Yet countless individuals have shared devastating experiences of neglect, disrespect, and inhumane treatment that leaves lasting scars. Imagine lying on a hospital bed, or sometimes on the floor in actuality, in pain and distress with no one to turn to. Imagine being forced to buy basic medications because they're not available, or being subjected to verbal abuse by healthcare workers. These incidents aren't just statistics, they represent real people, families, and lives forever changed by the care they received or didn't receive. We've heard stories of patients left unattended for hours, begging for help only to be met with apathy. We've seen cases of patients denied basic amenities like clean facilities, food, and pain management. These experiences aren't just about healthcare, they're about human dignity. Join us as we confront this painful reality. Make sure you share your experiences or those of loved ones. You make sure you let us know, have you or someone you have been have been treated with dignity in a Nigerian healthcare facility? I know a lot of us have lots of stories, what we've seen, what we've experienced. Let us know, call us, let us hear your thoughts, let us hear your experiences, and probably ways you think things could be gone about in order to make sure that those human relations are treated properly, people are treated properly, and things you think are done wrong. So make sure you call us on the numbers that are displayed on your screen. Get involved in this discussion. Let us hear your thoughts. Send us a WhatsApp message as well, and let's know your experiences. Let's get the conversation started. As I said, call in now and share your story. Your voice matters. But before then, let's take a look at this video that has been trending within the week. All right, that was just a short clip that has been going around. Unfortunately, there wasn't audio on it, but the federal government has launched an investigation into this particular viral video showing a patient at the emergency unit of the Federal Medical Center, FMC Jabi, here in Abuja, where medical personnel appeared indifferent and cited inadequate manpower and medical supplies for delayed attention. Well, this, I believe, we would say has been going around all over Nigeria with, delayed attention and lack of proper care. And most of them complain of inadequate manpower as well. We have our first caller on the line. Hello, good morning.
Good morning. How are you, my sister?
I'm doing fine,
Ade,
thank
calling
you.
from London.
Thank you for calling, Ade. How are you doing this morning?
I'm okay. Are you?
I'm doing great. Thank you very much. Let us hear your thoughts on this issue.
Yeah. Going by what you said, and they have just displayed now, I feel bad when I saw the video clip. Not only that, on Lagos television this morning, I call in Lagos, a woman called in and complained that the baby was taken to an hospital in Lagos, and they said there is no light and they couldn't treat them. They went to about 2 or 3 hospitals. They said there is no light, they don't have this, they don't have that. Just this morning, Lagos television, and I call in to blame the local government that how on earth will also not have a light. They said there is no light, no petrol in the generator. This just this morning. So this is an epidemic now in Nigeria. Because look at this one we are talking about. And this one was just this morning in Lagos television. The woman was complaining about that twins. So, and I echo our voice that government should do something seriously. I think it's not our Our doctors, they're after profit. They just want money. And when they come here, they are very serious. Very, very serious. When they come here, my local here, the hospital, I mean, they have more than 10,000 staff here. It's a very big, massive. But trust me, the top doctor there are Nigerians. Even me, myself, I've seen them, Nigerians. But they will behave well. But when they get to Nigeria, they just take it, they don't even care. Or they are complaining there's no gloves here or there's nothing. How much is gloves? So government should, Minister of Health has a lot of work to do. It should somehow the Commissioner of Health in the whole Nigeria, that's state, and warn them seriously. Human life is very, very sacrosanct. So because when we are seeing things like this and hearing what I heard today in Lagos television, I'm not happy about it. Hospital is where you go and you get attended to. Our government pump a lot of money to NHS here because we pay tax. So you go there, you get the first class treatment you want. Free of charge, you go home. You don't pay nothing. But I'm not saying they should not pay in Nigeria, but let them get the treatment they are paying for. That's my advice. God bless Nigeria.
All right, thank you very much, Ade, for your contribution. Well, as he made a point of, he said, since the Nigerian government is not giving, free healthcare, at least they should be able to provide proper healthcare for the people that healthcare that they're paying for. So, that in itself is another angle you could look at. We have another caller on the line. Hello, good morning.
Good morning, Hauwa. This is Shetima Kudima from Maiduguri.
Good morning, Shetima. Thank you for calling. How are you doing today?
Alhamdulillah.
All right. What are your thoughts on
the patient with dignity? Honestly, in Nigeria, as what Ade was saying, it was in England. England was strictly supervised, and their activities was monitoring. It's all like in Nigeria. Person can open his own hospital, private hospital. He will maltreat people the way he wish, provided if he will pay tax. Government doesn't care to supervise. Either state government, local government, or federal government. They don't care. If at all you will settle that tax that they give you, then you can go ahead. You do whatever you want to do. And you see, I was eyewitness. A accident victim was have dealt a deep cut, and he was receiving treatment without light. The light was candle. It was off candle with a candle, and the nurse was sweating, and the patient was sweating. So this is Nigerian operation. So and also if you look at it very well, in Nigeria, health sector has become exploitation center and extortion. They know that you are sick, you are desperate. What you are after is your health. So they take that opportunity. They overbill you. Even I know some hospitals, which they after you have been discharged, the charges for oxygen was inclusive inside your bill. Even you do not take that oxygen. You do not take that oxygen, they will still charge you. That's the problem that we are just facing. But to me, it will be very good for government to step in with strict monitoring to sanitize our hospitals, to get up to standards, and then make sure that any private hospital should not open if you do not set either solar system or standby generator, and then make sure that that generator was on coil all the time. Because you cannot collect some people, you cannot collect people money, and you do not give them that services. So our health sector has become something else, and our medical worker, They have become reckless. They can even insult a patient. You see, that's the problem that we are facing. They are both their ethic of profession. They are doing whatever they want to do, simply because somebody was ill and he come in to look for his health, and that's why this is the pain is paid. So that's our problem, honestly speaking. We are just asking God to bring sanity, and government should take measures for strict compliance, and a patient should be given a dignity and respect. Thank you so much. Have a nice day.
All right. Thank you very much, Shatima, for your contribution. Implying that in actuality, health is wealth. And at the end of the day, when we look at this huge issue that is recurring, we would have to look at a couple of contributing factors that have made the healthcare system having some medical negligence. But then let's take our next caller. Hello, good morning.
Good morning, this is Abasekong calling from Gombe State.
Good morning, Abasekong. How is Gombe this morning?
I want to sincerely thank God that the first caller, the second caller, they have spoken very, very well. It is all centered on indiscipline. We don't have policy on ground. We don't have transparency. We don't have accountability. We don't have probity. That is just what is killing us. When Nigerians go out to Saudi Arabia, they perform. When they go out to London, they perform. When they go to America, the best medical practitioners, they are from Nigeria in America. My brother used to tell me how they are so vibrant, how they work workaholic. Each time there is a patient, they call them from home. You see, that is the problem we are having here. The problem we are having because they want to run out of this country. That is just the issue. They are so centered on money-centric. They are so centered on money. Unless we change this myopic sense of reasoning, if that is not checked, it will still continue to be the same thing. And I want to add by saying that any law that forbids the people to speak is nothing but a shackle of slavery. I thank God for this Trust TV. They continue to give us opportunity to speak our mind. If not, we are all in slavery. There are a lot of television stations. They don't speak. There are 2 stations from Akwa Ibom, from my state. They don't speak. Even when I tell them the truth, they stop phone calls. You see, that is the problem we are having. Unless we change the orientation is being brought online. It's being brought online. Doctors, stop them. Suspend them. I visit the Federal Medical Center twice in a week or 3 times in a week. I see the way they are working here, Federal Medical Center. I see the way they are working in the general hospital. I always go there to visit the patient. Our government should do same. They should do checks and balances. They should be visiting a surprise visit. Even the governor should be visiting to see what they are doing. Or send spies, underground surveillance. They should survey them and see what they are doing. Even in our ministry, in our police, in our DSS, underground people to be monitoring them. Once you do this, you see they will sit up. It's because we have nonchalant attitude. Nobody cares. Everybody is after money. That is the problem. Thank you this morning. God bless you. God bless Nigeria. God bless Trust TV for giving us the opportunity to constantly our views. Thank you.
All right. Thank you very much, Abasinko, for your contribution. He attributed some of the, lack of should I say medical negligence, the inadequate care and delayed attention to the brain drain that's going on in Nigeria, where doctors travel to find greener pasture. But then there are a couple of factors that might be contributing to medical negligence in Nigeria, which could be the inadequate training and staffing due to the fact that there's a shortage of qualified healthcare professionals, which attributes to the brain drain that our caller just spoke about, and inadequate training programs called to be major contributors, whereby even as time goes on and a medical practitioner is practicing, there aren't other programs that aid in training those medical practitioners. We have another caller on the line. Hello, good morning.
Good morning, Fatima. Good morning, Trust TV. Good morning, viewers.
Yes, good morning. Thank you for joining us. What's your name and where are you calling from?
Yeah, thank you very much. I'm calling you. My name is Raji Salisu, calling you from Kaduna State.
All right, good morning, Rabi Usalisu. Thank you for calling. What are your thoughts on this issue?
Okay, you are talking today healthcare services. Yeah?
Yes.
Patient treatment.
Hello? I believe we lost our caller. Please do well to call us back. Let us hear your thoughts and your opinions. Make sure you call us and let us hear your experiences or experiences from your loved ones. Call us on the numbers displayed on your screen and let us have a talk. In conditions and factors contributing to those medical negligence in Nigeria, a lot of people have complained. A lot of lives have been lost due to those medical negligence. There's another aspect when it comes to limited resources as well. Do our hospitals have enough medical resources in making sure that the patients that do visit those hospitals are able to be taken care of properly? Do they have that? You would go to a hospital where beds are not enough for the patients that come to the hospital to be admitted at the hospital. We have a caller on the line. Hello, good morning.
Yeah, good morning.
Yes, thank you for calling us on Daybreak. What is your name and where are you calling from?
My name is Chijioke. I'm calling from Nsukka in Enugu State.
All right, good morning, Chijioke. What are your thoughts on this issue?
Well, obviously, like everything Nigerian, most time we have beautiful policies, but implementation is the problem. As regards to healthcare services, I think poor remuneration of medical staff, that's one factor that is responsible for the Jackpot syndrome of the medics we have in this country. Then most of our hospitals are poorly equipped, obsolete equipment. So you find out that most times when people get to these hospitals, we don't have the facilities for emergency treatment, to keep people alive. So like in case of emergencies or accidents, you find people that are, left on the bare floors because of lack of beds and all that. Then the doctors are inadequate because most of them want to go and look for greener pastures overseas where their welfare be taken care of properly. And of course, a whole lot of issues that militate against the poor healthcare services in the country. So the government has to up its game. It is not just enough to buildings don't revive people or treat people. You need the manpower, training and retraining of staff. You go to most of these hospitals, you have these quack nurses that are employed because most of the doctors can't employ well-trained nurses. They can't pay them well. So they use auxiliary nurses and things like that. So, and of course, life is key. There is no life that is inferior. Every life is important. We have to place premium on the life of every Nigerian. What I have discovered is that the government and the people, we don't have regards for human lives. And that is why you see people dying carelessly every now and then. In case of emergencies, you go to the hospital, you don't receive prompt attention. They'll tell you there are no doctors, or they tell you there are no drugs, or some crazy kind of excuses you get to hear every now and then in the hospital. So, I believe we can still do better. We can still do better if government decides to change, certain policies about healthcare. We need to put in place an health insurance scheme. Now it's limited, I think, only the federal staff. So sometimes when people are sick, but they look at the exorbitant charges, they better resort to self-help or self-medication. And some of these things they are neither here nor there. So it's just the agonizing stories every now and then that we keep praying and looking up to God that someday we'll get it right. Thank you.
All right, thank you very much. He made a couple of vital points where he addressed the situation of healthcare and having a health policy in Nigeria. And there are a couple of healthcare policies that are moving on, like the universal health coverage, which is actively being worked on. But then having healthcare coverage in Nigeria, some people might indulge in that and can be able to, be able to participate in having in healthcare insurance or healthcare coverage. But some people cannot afford even that in itself. But then at the end of the day, aside from having a healthcare policy put in place, there are a couple of challenges aside from having a limited health insurance enrollment. You would have a high mortality rate, which has been identified with maternal and child health. That in itself is a huge number according to research reports and statistics. There's a high number, particularly of mortality rate, particularly in maternal and child health, which always remains a priority, as well as in accident victims as well. We have another caller on the line. Hello, good morning.
Yeah, good morning.
Yes, thank you for calling us. What is your name and where are you calling from?
My name is Lazo. I'm coming from Kaduna.
All right, thank you for calling us. What are your thoughts on this issue?
Actually, I would like to talk on the issue of civil servant pertaining to the healthcare.
Well, our question is, are patients treated with dignity? If you have an experience, you could share with us. Hello?
Hello. On the issue of HMO, I think on the issue of HMO, I'm talking about.
I believe we have a technical issue, network issue. Make sure you call us so that we can hear your thoughts. Call us back. Your thoughts are important. All right. Having a lot of maternal and child mortality, high rate of mortality, we have high rate of mortality when it comes to accident victims, just as in the video that we saw earlier. And the incident that happened earlier this week or last week, we saw that it was an accident victim that was brought to the accident and emergency wing of the hospital, but then they were refused to be attended to, which is quite sad and quite heartbreaking. We have a caller on the line. Hello, good morning.
Hello, good morning.
Yes, good morning. Thank you for joining us. What is your name and where are you calling from?
My name is Nazir Ibrahim. I'm calling from Kaduna State.
All right, thank you for calling us. What are your thoughts on this issue?
Yes, I can see the topic of discussion is that are patients treated with dignity in our facilities here in Nigeria?
Yes. What are your thoughts on that?
Yes, and when it talks to it, yes, while the issue of dignity in patient care in this country, it has long been lost. Simply because the government is not showing concern to the situation that our healthcare facilities are. You can see that nowadays there are no employment. The government is not employing. If you go to many general hospitals, you see that there are no staffs. There is shortage of manpower. And in the primary healthcare facilities, there is no adequate staffs and equipment to even take care of the minor ailments that they are supposed to be taken care of. So the facilities where the staffs are available, no matter how little are they, the work is too much on them. So for you to say that you consider all patients at all costs, it will be difficult. So in order to reform, in order to treat our patients with dignity in this country, the government has to reform the situations, the nature of our healthcare services. There should be employment and there should be renovation, because despite the renovation that the government is doing in some places, they will renovate the structures, but there are no equipment, there is not manpower. So where will the patient, how will the staff take care of the patient? So my advice here finally is the fact that the Nigerian government is ready to reform healthcare facility. There one should be employment. Two, there should be provision of all those healthcare gadgets that are needed for emergency and everything. And there should be renovation of the structures, because you see in some places the influx of patients is much, but there are not enough structures to keep them. You go, they say no bed. Instead, you refer.
All right, thank you very much for your contribution. That was an insight. As he shed light on this issue, he said inadequate resources, limited or lack of basic equipment and infrastructure, which is furthering the increase in the risk of errors. Aside from error, we have to look at training and retraining, because at the end of the day, sometimes when the work environment is not conducive as well for the nurses, for the doctors, for all the medical practitioners, at the end of the day, they lose focus, they lose interest as well, even though it pertains the human life, which is very, very important. We have a caller on the line. Hello, good morning.
Good morning. It's me, Ravi Salis, calling you from Kasana State.
All right, thank you for calling back. What are your thoughts? Let us hear them.
Okay, the healthcare services, the healthcare services in Nigeria are comatose, because right from the recruitment of health workers down to the work delivery is something unrealistic, because the normal behavior that most of our health personnel have been showing is actually illogical. There is some certain incidents where a patient has been slapped by the maternity, by the nurses. It occurs several times. So the behavior they have been displaying in the place of work is quite atrocious. They are not trained to be taught how to disturb the patient. They are trained to take care of the patient, to assist the patient, to encourage the patient, no matter how the magnitude of illness he has. But they are not doing it the same. They are not doing the right things in many hospitals. That is why when you look at the history, in 2020, the coronavirus pandemic has shown the weakness of health sector in Nigeria. That is why a lot of privileged and politicians went abroad to seek for medical attention. Living was supposed to die under the facts. So a lot of quacks So even the schools that give us training need to be scrutinized. The certificate can be given to individual owners should be properly monitored. Ensure that the person who gets the certificate know how to handle the patient, know how to take care of the patient, and how to work efficiently in the hospital. Because they are dealing with human life, not animal life. So the government has the right to provide infrastructure, but only propaganda. When you go to the government hospital, you have there are no staff, no clinical staff, no on-site staff. The condition of health is very poor. Look at what happened this in Abuja. It's quite unfortunate. In our domain, somebody can come with gunshot wound, maybe by bandit or over these crimes. But you not to be sometimes assist immediately until his blood has opened and eventually the patient may die. So this amount of money that
I believe our caller is having network issues, but he made a couple of vital points. Looking at the healthcare system, our hospitals, our primary healthcare, facilities, they are underfunded. They don't have facilities. And when you look around, I could remember there was a time, in actual truth, as he said, a lot of people, a lot of politicians, people that are well-to-do, when going to the hospital, they sometimes leave the country or go to private hospitals. But if you do not go to those government hospitals and see what is going on, you would not believe. I had a shock of my life. I went to a public hospital and there were people on the floor, patients on the floor, because there weren't sufficient beds for them to be on there. Mothers, pregnant women, complaining that they were maltreated when they go to give birth, not being properly taken care of. When an accident happens, patients are taken to the hospital, they're left there to bleed to death. So we have to look at that and make sure that health is wealth, and a human life is very, very important. But would have to come to the end of this segment. Thank you for all your contributions. Thank you for being with us. Make sure you continue staying with us.